Welcome friends, welcome colleagues, welcome students, residents and fellows on your site, MuniMeterHealth, the source of learning cardiology and of course about human heart. This is Dr. Jaitly, your cardiologist from New York. Our major aim through these short video episodes is primarily to improve the medical education and patient education both. Remember, our audience is not only medical community but also general masses, and we want to try and see how best we can improve the health literacy, because eventually doctors will go back and treat their patients, but they'll have to educate the patients also in order to improve the clinical outcomes. So this way they become more compliant. That's our major aim at MuniMeterHealth. So welcome again on MuniMeterHealth. What is valve stenosis? That'll be our new subject today in this short video. Aortic stenosis, we are taking two prototypes, aortic stenosis and mitral stenosis, as AS and MS. As I've drawn in these figures here on the left lower half panel, if you will, I've tried to show based on what a 2D echo Doppler study will reveal. Now, mainly for the medical students, of course, the fellows are already aware of it, but just to let you know, the heart is represented in the echo in an inverse fashion. In other words, the top chambers are at the bottom. These are your atria, and these are your ventricles. Okay, so just for the students to orient themselves, because normally the atria are on the top, as we know in the human physiology or human anatomy. But here in the echo Doppler, we are showing the atria at the bottom and the ventricles at the top. Now, the right side obviously has been shown as showing relatively deoxygenated blood, and here, of course, you have an oxygenated blood. It's been shown as the red arrow. So mitral stenosis, which is here, that is now impacting either because of the rheumatic etiology, where over a period of time, patients that had arthritic symptoms, skin rashes, nodules, fever, sore throats, high ESR. These are the classical symptoms and signs of rheumatic heart disease, where there was initially a murmur, but later on now we have what it looks like is a early diastolic. And then, of course, there is a presystolic accentuation, which I have not shown here, but a presystolic accentuation which occurs, especially these patients here, they are normal sinus rhythm. If you have atrial fibrillation, then presystolic accentuation is lost. So just so that you remember. But anyway, basically, it's a diastolic rumble, if you will. It's only heard at the apex. If you were to auscultate the patient, you may have to turn the patient into the left lateral position in order to hear this diastolic rumble. Now, this diastolic rumble will appear on an echo Doppler when you put your Doppler volume, Doppler sample volume right here at this level, or right here at this level where the valves are situated. You will see that the valve is not able to it's impeding the blood flow into the left ventricle. So there is an impedance of left ventricular flow. So there is no blood going, or very little blood going through the mitral orifice, if you will, because the orifice gets narrow. Normal area for the mitral valve area, we call it, is about 1 centimeter square. That's the normal. Now, anything less than 1 is considered as and if it's less than is considered as mitral stenosis, but anything less than 0.5, 0.4 is considered as severe mitral stenosis. So here we have tried to show you the mitral stenosis, which is shown as a diastolic rumble if you were to listen to the chest. And let me just take this off. And it's basically implying that there is an impedance of blood flow across the mitral valve orifice. In order that the blood should normally flow freely into the left ventricle, it's not flowing, and it's all accumulating here within the left atrium, and as a result, the left atrium will start enlarging, folks. What will happen to the left ventricle? The left ventricle will be small because there's not much blood going there. So the left ventricle has no reason to really enlarge or hypertrophy. It's the left atrium which is constantly coming up. Left atrium which is enlarged. And as a result, the blood backs up into the lungs. So patients will have shortness of breath. They may have chest pain. They may have winter bronchitis, we call it, or chronic bronchitis, because then they are coughing up blood sometimes. They may have sputum tinged with blood, hemoptysis, as we call it, and what have you. So shortness of breath, chest pain, sometimes swelling over the ankles. Ankles will have swelling. So these are some of the symptoms, and that's because the right side starts enlarging as well. Over a period of time, there might be hepatomegaly, the liver will enlarge, and so on and so forth. So it's mainly all the other three ventricles that all the other three chambers, they really take the brunt. The left ventricle stays small, so left ventricle is unaffected, at least in pure mitral stenosis. If you have a mitral regurgitation, then of course the left ventricle will also start to enlarge in hypertrophy. So this is where we have shown. Now, if you were to, so the pulse wave really shows a decrescendo, an early diastolic rumble or decrescendo, and then a presystolic accentuation, if you will, of that kind, which will be seen here as well. So there is a presystolic accentuation, and this is a diastolic rumble. Now, normally what you do is mitral stenosis is calculated by a very, it has to be reported in the area form, right? MVA. And echo Doppler is extremely proficient in defining that. And the formula for that, there's an equation, if you wanted to remember, is 220 divided by pressure half time. So you have to look at the pressure half time, and that will define your mitral valve area. So whatever the pressure half time, in other words, how long did it take for the pressure to drop from this level to exactly the half level, to the half of this level. So say the pressure half time is here somewhere, that's where it dropped into half. So that will become your pressure half time. That's calculated on your echo Doppler screen, and you will be able to determine what the mitral valve area is. And as I said, normal mitral valve area is more than 1 centimeter square, and if it's less than that, then depending upon the grade of stenosis, one can define whether it's mild, moderate, or severe. Okay, now let's move on to the aortic stenosis. So this was mitral stenosis, folks. Now we'll go to the aortic stenosis, right? Because that's the limitation we have in these short videos. We want to quickly cover and give you a quick grasp before you attend your tutorials, sit for the boards, take your exams, and what have you. All right, so aortic stenosis is at the level of the aorta. Now look at these valve leaflets. Normally the blood should flow from the left atrium into the left ventricle like this, and then as the ventricle contracts, all the blood should really go only into the aorta and supply the rest of the body. So that these valves will stay shut at that point, and the left ventricle is moving inwards or during systole. So remember, this is happening in systole, that the aortic stenosis impedes, or the valve which is now narrow, the aortic valve area, we call it AVA, just like we had the MVA here. This is AVA. That aortic valve area is narrow. Again, what is the average aortic valve? Normally should be more than 1 centimeter square. Anything less than 1 centimeter square is again defined as significant aortic valve stenosis. Now, aortic valve stenosis, it's occurring in systole, just like mitral valve was occurring, mitral stenosis was occurring in diastole. This is occurring in systole. And because aortic systole is now prolonged, you will have a prolongation of the aortic ejection time. And not only that, the force which because the left ventricle has to ultimately empty out, and because it empties out with a huge force, it hypertrophies as well. So there's a lot of hypertrophy one sees in the left ventricle, and left atrium will also suffer a little brunt, and that will also hypertrophy. So there is LVH, there is LA enlargement. So these are the additional features on the echo on the 2D echo that you will be able to see on the echocardiography. Now, when you move to the Doppler, you will see it's the jet that is occurring in systole, which is extremely high in velocity. So if you had to measure this into a scale and scale it and measure it on a scale, say this being 1 meter, 2 meters, and 3 meters, this is roughly the velocity should be about normal aortic velocity should be about 1 to 1.2 meters per second. But in this case, hypothetically, we have shown it's almost about 3 meters per second. So when it is 3 meters per second, obviously it's extremely high, and that will define that there is enough pressure gradient across the aortic valve. And because there's enough pressure gradient, we can calculate the pressure gradient by the Bernoulli equation, that is 4V square. 4 times the velocity square. Okay, 4 times the velocity square will give you the pressure gradient. And what is the pressure gradient here? This is 3 times 3 is 9 times 4 is 36, folks, in this example. Okay, so in this example you have 36 millimeters. So again, 3 meters per second. 36, yeah, 36. So that is here. So this is a mild form of I would say aortic stenosis. But if it goes to 5 meters, where you have say if it goes to 5 meters, then 5 is 25 times 4 is 100, and that is considered as a very, very significant. So if the velocity is 5 meters per second, or even more than 4 meters per second, that will be considered as significant or severe mitral stenosis. So remember, 3 is a mild mitral stenosis. This was a mild mitral stenosis, but 4 is a very, very severe form of mitral aortic stenosis. Aortic stenosis that's occurring here, because the impedance of flow is all dependent upon the valve area that is being stenosed or has impeded its flow. Okay, so this is where we are with our aortic stenosis. Okay, so I hope you enjoyed grasping basic information about aortic stenosis, mitral stenosis through our very short lecture here. Remember that this is now here the murmur, just so that FYI, the murmur is actually defined as more like a diamond shaped, and it's occurring in mid-systole. So it is mid-systolic murmur, and there might be some ejection clicks here. Those will be the ejection clicks that might be heard, and again, these are best heard in the aortic valve area. Aortic stenosis murmur is heard best in the aortic valve area. Mitral stenosis murmur, which is a diastolic rumble, is heard only in diastole with the pre-systolic accentuation, only at the apex, whereas this is and by the way, the aortic murmur can be conducted to the aortic to the carotid arteries as well. So one can also feel the bruit, and it's a very, very obviously a loud murmur, and one can hear sometimes a thrill or feel a thrill even in the carotids or on the chest as well. So here we are with aortic stenosis, mitral stenosis. I guess rest is all beyond the scope of this video. It's a short video. We like to keep the videos as short as possible and give you the most encapsulated form of some information here. Remember these two equations: mitral valve area calculated by 220 divided by pressure half time, which is very easy for you to calculate once you're doing the echo Doppler. And aortic valve area is calculated primarily by the by the continuity equation, but you can actually estimate the pressure gradient by the fact that you have the Bernoulli equation available here, which is 4v square, and depending upon what the pressure gradient is, whether it's 20, 30, 40, 50, you will define whether it's aortic stenosis of which variety, mild, moderate to severe. Again, 4 meters and above is definitely considered as severe aortic stenosis. Okay, folks. All right, and again, stay tuned. MuniMeterHealth is your source of learning on videos here on our site. We are trying to give you the best information in very short time, and stay tuned for more as we progress further. Thank you again. This is Dr. Jaitly. So long. Bye, guys.